Hello, everyone. My name is Daniel Lyman, and I'm the executive director of the Mind Body Therapy Center, as well as a lead facilitator at the Pain Reprocessing Therapy Center. But today I am here to talk to you about pain reprocessing therapy, or PRT. This is an introduction to what PRT is and how it works. PRT 101 is what I'm calling this. What is PRT? As I said, it stands for Pain Reprocessing Therapy. It is a type of psychotherapy that was developed over the last 10 to 15 years, and it is designed to help people overcome chronic pain. So, just like other psychotherapies like cognitive behavioral therapy or dialectical behavioral therapy, pain reprocessing therapy is also a talk-based therapy. How is PRT different than these other therapies? Well, this is a really important point, and I want to make sure people hear this, is that PRT is not a pain management based therapy. PRT is about helping people overcome their pain, reduce or overcome entirely. So we're not looking to tell people, hey, you're in chronic back pain, or you've got chronic migraines, or what have you, and you're going to be stuck with them forever. We're not saying that at all. We're saying the opposite. We're saying, actually, this therapy can help you reduce those symptoms. Is it 100% effective? No, because no treatment out there is 100% effective. Is it highly effective? Yes, which is all the research that we have so far demonstrates that it is highly effective, and we're continuing to do more research. But again, I want to reiterate, this is not pain management. We're not here to tell you that, oh, you have to live with this kind of pain. PRT is concept and principle based. And what do I mean by that? What I mean is that this is not a modality that says, okay, follow these 3 steps and you're going to be out of pain. This modality says, if you begin to shift your understanding and your thinking and your beliefs in this direction, you're going to notice differences in your symptoms. What makes PRT effective? So, early research suggests that there are 2 major elements of PRT that are effective. Pain reattribution is the first one. What do I mean by pain reattribution? So, pain reattribution means we think about where our pain comes from in a different way. Most people that come to me as a therapist wanting to get rid of their chronic pain say, oh, I have back pain because I've got a slip disc, or I've had these surgeries, they didn't work. I've got this problem in my knee. I've got X, Y, or Z disorder that is then creating my pain. So, what that means is that your brain and people around you have told you, okay, I have pain because of this problem in my body. Now, pain reattribution is a way of saying, actually, we're going to see if we can look at the pain a different way and say, is the pain because of this problem in our body? Or is the pain a what we call neuroplastic symptom? Is this because the brain is sending you signals of pain, not because your body is saying there's something really wrong here and this is why we should have pain? Because pain is a protective mechanism. Pain is there to help us. Sometimes, however, the brain sends us pain to help us in the wrong way. Get more into that a little bit later. But pain reattribution is about is shifting our understanding from saying, I have pain because of this problem in my back, to I have pain because of neuroplasticity, because my brain is sending signals that I should have pain when I actually don't need to experience those signals. I don't need to be having pain, for example. Major element that demonstrates why PRT is so effective is because PRT helps change our beliefs and behaviors. Belief is a little bit similar to pain attribution. We're understanding our pain in a different way. And when we begin to do that, we behave differently. We're going to get into this in a little bit, but what I want to challenge you to do at this moment is to start to think about how your life has changed because of your symptoms. Now, I don't mean broad things like, oh, I didn't get this job, or I didn't go to this wedding, or whatever it is. What I mean is your day-to-day life behaviors. I sit with a cushion underneath my butt when I'm sitting because it makes me feel more comfortable, because otherwise I'd be in too much pain. Or I always do something with my left hand instead of my right hand. Or I don't walk in that part of the house. Or I always walk this way. Or I avoid these kinds of lights or these kinds of foods or what have you. I want you to start thinking about those things, and we'll get back to them in a little bit. Because those behaviors sometimes inadvertently help perpetuate our symptoms. So, how can we get confident in the neuroplastic diagnosis? There's a lot of ways to do this, but this is PRT 101, so we're going to keep it simple. And this, honestly, is one of the most effective ways to do it. It just takes a fair amount of discipline. So, what I want you to do is take a piece of paper, and you can pause the video here to go get a piece of paper and a pen. And I want you to draw a line down the middle, kind of like we have here on this evidence sheet. On one side, you're going to put neuroplastic. On the other side, you're going to put structural. Now, what I want you to do when you're done watching this video, or pause it now and do so, is to write down all of the evidence you have that your pain is neuroplastic. You may be sitting there and saying, Daniel, I don't have any evidence whatsoever. This is new to me. How would I even know it's neuroplastic? Totally fine. Just think about it conceptually for right now. You're going to write down all the evidence that your pain is neuroplastic. You're also going to write down all the evidence that your pain is what we would call structural, so stemming from those physical causes. Now, one of the things we want to think about with neuroplastic pain is inconsistency and variability. See, means, okay, when I do this activity, I get a 7 out of 10 pain. But it's weird. Yesterday I did the activity and I got a 4 out of 10 pain, or a 2 out of 10 pain. Or sometimes I'm able to do the activity and have no pain. Or sometimes it's a 10 out of 10 pain. It's inconsistent. Our pain is inconsistent in spite of the activities we're doing. Even if we do them pretty regularly, our pain is all over the place. That shows you there's a neuroplastic component. If there was something structurally wrong, you'd have the same amount of pain every single time. So think about that when you're thinking of neuroplasticity. So inconsistency, and then the other one was variability. So when our pain is variable from moment to moment or from place to place, that's another really good sign of neuroplasticity. So if your pain is in your knee at one moment, one day, one week, and the next week it's in the other knee, or it's in your head, or it's I've got a rash now. If we've got symptoms that bounce all over the place, variable, then that's a good sign that this is neuroplastic. If something's fundamentally wrong with your body, it's going to produce a similar result no matter what. Whereas neuroplasticity is variable. That means there are unconscious influences at play here. Again, we're not conscious of them, but there are unconscious influences at play here that are making your symptoms variable. Inconsistencies, variabilities, that's what we want to look for. When it comes to structural evidence, we want to look for consistency. Okay, every single time I do this. Now, that doesn't inherently mean it's a structural problem, but it does give us some evidence that it is. Or, you can write down the information that, okay, I got an MRI. The doctor said I have this. I have a slip disc. I have a bulging disc. I have arthritis in my hip. I've got whatever, you name it. That says to me there's something structurally wrong in my body. That is evidence we want to write down. We don't want to try and convince ourselves one way or the other. We want to write down all the information that we have and make sure we've got a very clear picture of what this is. Now, this process will take some time. So when you do this evidence sheet, don't think that you're going to be done in 5, 10, 15, 20 minutes. You're going to put it somewhere where you can see it, and you're going to add to it anytime you get a new piece of evidence. And that could be, man, I ran out the door today. I was late for a meeting, and I didn't have the same pain that I normally do when I walk out the door. Or I sat differently, whatever the evidence is, you're going to write it down. It's going to take some time, but you need to keep looking at this and reviewing it. So I'd encourage you to put this somewhere. I always tell people in their fridge or in their bathroom mirror or something like that. Put this sheet on there so that you can look at it regularly. Okay, let's go through this. I'm doing a lot of talking. Let's look at this evidence sheet here. So what you can see is that neuroplastic pain oftentimes, not always, oftentimes increases when we're stressed. Now, you may say, that's not my experience, Daniel. I don't have that relationship whatsoever. That's fine. That doesn't mean it's not neuroplastic. That's just one piece of evidence. So if you do notice that when you're stressed or anxious, that's a good sign that it's neuroplastic. Again, pain is inconsistent throughout the day. Pain jumps from one place to another, like I discussed. Pain is worse when I'm not distracted. Oftentimes when we're distracted with things, we don't feel pain as much. Another big piece of evidence is when the pain began. Now, for those of you that pain began with an injury, this is a different experience. But for those of you that pain kind of began arbitrarily, kind of out of nowhere, let's ask ourselves what was going on emotionally, what was going on psychologically at that time, because your brain has the ability to produce pain when there's emotional pain as well. So physical pain and emotional pain are actually kind of in the same part of the brain. And so they can be, when you're in a lot of emotional pain, you can experience physical pain. Think of it as having like an upset stomach or getting a headache when you're tired or stressed. And then the last one here that I wrote as just a piece of example here is that the same activity causes varying levels of pain. It's a great example of neuroplasticity here. This, as I talked about before, you do the same thing and it's all over the place in regards to pain. Structural evidence. Okay, the doctor said I had something wrong. Of course, yeah, we want to listen to our doctors. We want to understand exactly what's going on with our body. Of course, doctors are trained to associate some sort of structural problem with pain. We know that's not always the case. There's plenty of research that demonstrates that. However, we still want to listen to that. Okay, the doctor said I have something wrong. Write that down, whatever it is. As I said to you before, my MRI shows a disc bulge, herniated disc, whatever. I'm talking about backs a lot, but because I'm working on a back study right now. But whatever your pain is, wherever in your body, and whatever scans you've done, write that information down. Sometimes a piece of evidence is it hurts more when I move. Now, that's actually not always a piece of evidence of structural, but it makes sense in our brains. We're like, well, if I move and it causes pain, that must be because of something structural. There's conditioning that can be involved there, so that's something to keep in mind. But for now, write down whatever evidence makes sense to you in whatever category makes sense to you. Also, a structural piece of evidence might be medication helps. Well, I take this medication and my pain gets better, so that's a structural issue. Could be, yes. It also depends on what kind of medication you're taking. We have a lot of people that come to us and take a benzodiazepine or some sort of sedative, and they're like, well, my pain gets better. Well, those medications are acting on your nervous system, not actually on pain. So what they're doing is calming down your nervous system, and therefore your experience of pain is less. But regardless, put down medication. That can be a really helpful thing to understand of, okay, when I take this medication, I experience less pain. Maybe there's a structural component. This is one way and one big way to get confident in the neuroplastic diagnosis. So take the evidence sheet seriously. It really can help. How can you use PRT? So as we talked about, get confident in the diagnosis of neuroplastic pain. That's one of the key components of PRT. 2, make a list of behaviors in your life that are different because of your symptoms. I asked you to think about that a little bit ago. So what I want you to do is actually physically make a list. Okay, I don't, I don't sit the same way that I used to, or I don't stand the same way that I used to, or I don't stand for very long, or I don't go to the grocery store anymore, or I don't do whatever, or I do this particular thing and I avoid that particular thing. Make a list of those behaviors. Because when you get more confident that your chronic pain is neuroplastic, and as a side note, much of the research we've done demonstrates that most chronic pain is neuroplastic. I want to repeat that. Most chronic pain is neuroplastic, which means that you have a greater chance, I should say, of getting better than of not getting better. So keep that in mind when your brain starts to doubt. So again, we make a list of those behaviors. And then what we're going to do is organize those behaviors by the ones that we're least scared of. The ones we're most scared of, put at the bottom of the list. The ones we're least scared of, put at the top of the list. And we're going to expose ourselves to those behaviors to challenge our beliefs around them. Okay, let's say, for example, I have pain in my glutes, in my butt, and I'm afraid of sitting without a cushion. Now, let's say I'm only a little bit afraid of that. I'm not terrified of that, but I'm a little bit afraid of that. I'm going to put that near the top of my list. And once I become confident that that pain is neuroplastic, or at least somewhat confident, more confident that it is, then I'm going to challenge myself to sit. Now, exposure work is not, okay, I'm going to sit for 5 hours. Exposure work is I'm going to sit for a tiny little bit and just see if I can keep myself calm and relaxed while I do it. So I've done this with clients many times where it's like, okay, let's sit for 8 seconds. Let's sit for 8 seconds. That's it. Sit for 8 seconds. Oftentimes people have an emotional reaction after trying to do that. And then stand back up. Totally fine. Or lay down, whatever you need. Or whatever it is your symptom you're overcoming, make sure you're doing it in tiny, tiny bites. We don't want to do it once and think, oh my gosh, I've got more pain. This is bad. I can't do this again. I'm going to have pain forever. Let's do it 15 times. We can sit 15 times in 8 seconds, and let's do it over a week. Now you're going to say that's not moving fast enough. I understand, but the snowball will move faster and faster and faster as it goes down that hill, but it starts slow. So first, we expose ourselves in tiny little bites. So pick the number 1, 2, or 3 on your list of behaviors, things that you're a little bit less afraid of than the ones down below, and do a very targeted exposure to that behavior. So maybe twice a day you sit for 8 seconds, then the next day you sit for 10 seconds, then the next day 12, then the next day 15. And again, the goal here is not to do that behavior and get rid of pain. The goal here is to do that behavior and see if we can remain regulated and calm. And how do we do that? I'll teach you in a second. But the goal here, again, is not to get rid of pain. The goal is to expose ourselves to the behavior while remaining regulated and calm. You can come up with an exposure list yourself if you want. Sometimes it helps to do this with a therapist, but you can come up with that exposure list and figure out the times and how much you want to expose yourself on your own. That's totally fine. But be gentle. If you're the kind of person that rushes into things, that pushes yourself really hard, you're going to have some problems. So I really want to encourage you to take your time. Better to take your time with this and get over pain than re-traumatize yourself and have a longer process. Take even more time than you think. Okay, I told you a second ago that there is a way that you can keep yourself regulated. And that is the other part of pain reprocessing therapy that is quite helpful. And that is somatic tracking. Somatic tracking, in essence, is paying attention to your body without judgment. Use this tool when your pain is at a 5 or a 6 or below, and when you're about to do an exposure to behavior, like I talked about. So it's actually better to practice this first before you start doing exposure work and get kind of familiar with this, and then incorporate it into your exposure work. Somatic tracking is simply this. And actually, let's just do a quick exercise. I'll do a quick minute or two long exercise here so you get an experience of it. So go ahead and close your eyes for me. Get in a comfortable position. Hopefully you're not watching this while you're on the treadmill or on the bus, but if you are, that's okay. So do what you can to slow down. And what I want you to do is breathe. Just take a couple deep breaths, just like any regular meditation would begin. Take a couple deep breaths and pay attention to the part of your body that is giving you those sensations right now, the part of your body in pain. And let's just observe that part of you. Now, you may say, Daniel, I don't want to pay attention to it. It's scary. It's painful. Why would I look at that? I completely understand. What we're trying to do here is just look at it objectively, without judgment. So just breathe for me and draw your attention to that part of your body. And just like you would look at a painting in a museum or at an aquarium, just observe it. See if you can practice just observing without thinking about the future, about how much that pain is bothering you, about what behaviors you are or are not going to be able to do because of that pain. Just see if you can observe it like you would look at an aquarium, like you'd look at a painting, like you'd watch waves come in and out at the ocean. We're just going to take 20 seconds to do that, and I'll do it with you here. Remember, just keep your attention on that part of your body. Keep breathing in case you've stopped. I want to have regular breathing through this. Good. That's it. That's a somatic tracking exercise. That's it. It's not more complicated than that. Now, there are lots of other ones on the Curable app you can use, but you've done that once now with me, at least. That's the exercise that I want you to do and to practice. As I said, as I say on the slide here, this is a practice and should be treated as such. Take 5 minutes, a couple times a day, practice somatic tracking, especially if your symptoms aren't that bad. On days when your symptoms are really intense, it's hard to practice somatic tracking. But when they're, 5, 6 or below, 5 or 6 out of 10 and below, that's a great time to practice that. This is the tool that you can use before you do exposure work. That's to help down-regulate you and build in a neutral response to the sensations in your body. Are you going to be perfect at this? No, no one is. I'm not, nobody is. We're just practicing. It's like becoming perfect at an art. It's not possible. You're always working at the art to try and be better and better. And that's what somatic tracking is. It's just an art form that is going to help us have a neutral response to our symptoms and therefore be able to go into exposure work and do a lot of great progress there. So let's review. PRT is a therapy modality that helps people overcome chronic pain. The two main facets of PRT that help people overcome pain are, one, pain reattribution. As discussed, that is understanding and learning how our symptoms are not necessarily caused by structural problems in the body, but by neuroplasticity. And the next thing is behavioral changes. Once we've had pain reattribution, then we can start making behavioral changes to reclaim our life and to have more freedom in how we behave day to day. So those are the two big things. There's a lot more to PRT than that. But quite honestly, if you do really well with those two things, you're going to notice a difference. We see this all the time. I've seen thousands of patients over my career working with people in pain, and these are the two big things that help people the most. So thank you so much for joining me. Hopefully it was really helpful for you, and I'll try and do a longer PRT talk in the future.